Good morning, everyone. It's Melanie Stover with Home Care Sales by PowerShot Training and the Home Care Sales and Marketing Society. Today, we're going to talk a little bit about vertical integration, what to do when the hospital or the system owns everything. I know some of you out there have territories that are very vertically integrated, and some of you are just starting out on this process where you are beginning to have access issues. This is such a popular topic with the reps that I work with. I wanted to share with our society members and our list some tips that we've learned along the way. Please know that this is a preview for the Orlando conference. I know a lot of you are interested in the Orlando Summit. It's the Home Care Sales Executive Summit. It's in Orlando, down in downtown Disney, and it will be the 28th and 29th of January 2016. Please know that this is a very strategic conference with real-world applications. So all the speakers, myself, there's Tim Rowan talking about technology, Jim Plonzi talking about Medicare changes for 2016. We're lucky enough to have Lucy Andrews come and talk about private duty and the trends there. Liz Pearson will be there to talk about legal issues and some of those hot topics for 2016. So it's a really nice way to get your agency kickoff start to the new year. So please do go to homecaresales.com. Down at the bottom, there's a link, or go to HC, as in home care, hcsociety.com, and click on Save the Date for the Orlando conference to read the full agenda. If you stay here until the end, I will also give you a promo discount code. So please do stay to the end and get that discount code so that you can come with us. So today we're going to talk about vertical integration and what to do about it. We recognize that this is a preview, so we will do a more in-depth discussion with tools and techniques at the Orlando conference. But for those of you who wanted a preview and get started working on it now, I thought I would go ahead and share this as we move into the holiday season. So as always, I ask you to ask questions. That's what the question box is for over on the right-hand side of your go-to webinar control panel. Pop questions in there. I'll try to read them along the way, or at the end of the presentation, certainly we can do that. And in addition, the thing that I love about home care is our ability to share with one another. We have over 50 folks on this line right now. Go ahead and share with each other. You can share in the chat box, or you can go ahead and share in the questions and share your experience of what's worked. It's not always about all the problems that we have to solve, but some of us have done a really nice job in this area. And if you would like to share, I would sure like you to. So please do use the question box and the chat box to share with your colleagues out there. All right, so let's begin. We know that there are affiliations, joint ventures, and partnerships all around us. We hear words like ACOs and bundling, and we know that that some of these are coming down the pike faster than ever. Some agencies have done a really nice job of aligning themselves with skilled nursing facilities, with hospitals, with the TCUs. And as we all come into more of a vertical alignment, which is why folks call them vertically integrated networks. If your hospital system owns the hospital and the TCU or the SNF with rehab and the home care and the hospice and the outpatient, it just makes sense to them. If you think about where payments are going, it makes sense that they can control or try to control some of that care within their own system. We recognize that when we go to hospital systems, and I work on behalf of proprietary home health and home cares, we hear that often from leadership, that they're trying to care for their own, that they are trying to make their docs happy by caring for the patients who are under the umbrella of that system's care. They're trying to make hospital leadership happy by caring for the patients who come out of the hospital themselves. So we know this is a goal of theirs, and we see it in action every day. Consequently, if you are a proprietary home health, hospice, or private duty company or in-home care company, you are going to want to try and position yourself as a provider of choice for these bigger entities. Now, some of them are, not all of them are hospitals. Please know that there are a number of home healths who have created joint ventures along the way with senior living communities and other entities. So while today you'll hear me talk a lot about hospitals because that tends to be the big fish in your city, know that there are very creative home healths doing in private duty and hospices, doing very appropriate legal things through joint ventures and partnerships in the city also. Sometimes you hear them refer to them as an affiliation or a sister company. So know that it's not just the hospital. Recognize that. Please know it could be a larger entity, like a larger proprietary home health, who has taken the lead and has approached perhaps like a senior living community and in our partnership with them or a joint venture with them. So when I talk about the hospital, please know I know that it isn't just the hospital or just the system, but you can apply the same techniques if it's the hospital that you're dealing with or the system that you're dealing with, or if you're going to go approach maybe a super big home health who has taken on this role, this leadership role of a joint venture or a partnership or an affiliation with, in the example that I gave in the senior living community. So we know that there are affiliations around us. We recognize that the pie is it's not necessarily getting smaller from the standpoint of, oh, there are less patients to care for. But as they try to tighten up the referral structure, the systems or the affiliations, because they want to capture as many members or as many patients or clients as they can, we recognize that if you are a proprietary home health out there or private duty or in-home care or hospice, you are going to be feeling that. You're going to be feeling that obviously with lack of access into some of these places. You're going to be feeling it possibly with a decreased number of referrals. And so you may be looking for strategies, and the fact that you're here today just absolutely says that you are looking for strategies to help overcome some of these challenges with this joint venture bundling coming down the pike, maybe in an ACO. So, how do you, as a proprietary home health, hospice, or in home care, how do you position yourself best to be at the table? And that's really where we're at today. We want a seat at this table. We recognize that the hospital is going to do what's in its best interest. We recognize that they are absolutely going to try and capture more of their own patients. But how do we get a seat at the table? How do we become their secondary provider, for example? So, what do you do when they own it all? Oftentimes we go, gosh, we can't get into that hospital, but is there a larger issue here? Is it not just access, as in, gosh, they have too many home care reps calling on these case managers or social workers, and so they've put the kibosh on that and really reduced access? Is that really what's going on here? Or is that just a symptom of a greater issue, which is the greater issue maybe they're trying to capture more of their own patients, and so they're reducing the access points to other outside home cares so that there isn't such a distraction. And I think we've all seen that. The two big hospital systems that I've worked with lately, who are that I was working to position the agency that I was working for as a secondary provider, um, the care nav team or the care, like the case management team, whatever they're calling them these days. In this case, they call them care navigation at this hospital, but it's the discharge planners essentially. They're literally in a room off side of the hospital behind locked doors. You certainly can't just walk in. And it's almost like a call center. They've created a centralized location for that. So for any rep to walk in there and be like, hey, I'm Melanie, I'm from Melanie's Home Care, just isn't going to work. We recognize that today's calls and today's approach has to be much more strategic, because we're just not able to access some of the folks that we have in the past. So what do you do when they own it all? The first thing you got to do is take inventory of yourself. What do you have to give that they either can't or won't? So this same hospital system that I'm speaking here of in this example is a union shop. And so consequently, the union home health just isn't able to do some of the things that the proprietary home health is able to do due to union rules and limitations on the staff. Is there an opportunity there? What about staffing in general? Can they get out to see their patients? And in this case, our goal was always to get out to see, for example, those ortho patients in home health. We really would like to have a therapy team out there within 24, 48 hours. That would be our goal. Can the hospital do that? Are they in a position where they have enough PTs to actually get that accomplished? And are you? So if they're not, are you? Something as simple as coverage area. Are they really great in the metro, but then you go more rural and the hospital team is a little more sparse? So first, it's an introspection of what do we do well? Where do we think some of our strengths are? And then we have to query. As always, my mantra is good open-ended questions. So have we been able to query some of our own referral sources about, is the hot, and we get this a lot, the hospital's out a week, the hospital's out 2 weeks. And so therefore, would you be willing to pick up this patient? When we hear that, we utilize that in our sales messages, obviously, to go to other SNFs with rehabs or other TCUs to try and pick up patients during that high volume time for the hospital. So I think it's twofold. One is that there's an immediate thing that you can do, right, at a rep level. And then there's a much more strategic thing that you can do. So I talk about approaching it from the top down and the bottom up. The bottom up is the reps working with the other reps at the facilities, at the affiliation, or at the partnership. Oftentimes our reps are really good at knowing what's going on the ground. They're often colleagues, peers, friends with the admission reps or the liaisons or the nurse liaisons or the sales reps of the affiliation that we want to target. So of the hospital or of the joint venture that we want to target. And they can be on the ground gathering information for you as a leader, or you as a sales manager, or you as a sales rep if you're leading this charge. So the very first thing I do is gather information. You got to get your ducks in a row. You just can't go walk into leadership at the hospital and say, hey, I'm here. I want to help. It's just not good enough. So you got to gather your information from your sources. Look to your nurses, look to your leadership team. Oftentimes a lot of you guys have tremendous amount of experience in your nurses, therapists, caregivers, caregiver staff, supervisors, schedulers. Some of the, I can just think of one right now, one of my favorite intake schedulers. She has been in this business for 25 years and just about knows everyone in the home care community. And so she's a plethora of information when I need information about that particular little city. So look to your staff, identify how you may be able to get into the hospital or the affiliation or to the system. Who knows whom? How can we get into that particular place? And you got to lay a lot of groundwork with this. Sure, the easy task is when you hear somebody who says, oh, the hospital's out a week or 2 weeks, for sure, use that information. That's very tactical, and you can immediately have an impact on the numbers by going out to the other potential referral sources and saying, hey, I hear the hospital's out 2 weeks. We're not. Let's go ahead and get that patient home and get them seen. So I agree, yes, first, you can be very technical, but if you're looking at big picture, you're going to have to do some groundwork here of identifying what are some of the challenges, what are some of the challenges the hospital's having, what some of the challenges local referral sources are having with the hospital in this example, and do you have a solution for it? Can you do it better? than them. And sometimes that's the answer. I work with a client in Texas who proved that his team could care for CHF patients better than the better than the hospital home care, and had lower readmission rates. And so even though intuitively you would say, oh gosh, everything's going to go to that hospital, because he was able to prove through a pilot program that he can do it better, now they have a decision to make. Do they send it to this proprietary home health that's not affiliated with the hospital in order to gain those patients lower readmission rates? And so that is a discussion that they're in the middle of, and sounds intuitive for them, or logical for them, to go with the proprietary home health to instead of their own home care, because we recognize that they're doing a better job at treating those patients. So this slide is all about gathering information. What do? The first thing you do is get as much information as humanly possible about that, some of the challenges that the hospital's facing. If you're in in-home care, we recognize there's some very innovative, really interesting things going on with some of the hospital systems providing in-home care services, or having in-home care services be contracted to take folks home to get them set up. We also recognize that they're high risk. They're looking at high risk patients to be taken home with a caregiver. So there's some really neat stuff going on at different hospitals. It's a matter of getting to the right people to have those discussions so that you can then present your services or become a partner. And sometimes it's just I just thought of a case right now where we recognized at an in-home care, the hospital also had private duty, but they quite didn't do it well, to be honest. They couldn't do 24/7 cases. They didn't do live-ins well. And so this particular in-home care that I was working with had the luxury of going to that private duty and saying, hey, I recognize that I recognize you have a financial responsibility to the hospital, and you're going to take the in-home care that you can. But what about the in-home care that you can't? What are you doing with those? Wouldn't you rather have a trusted partner instead of turning those folks away and just letting them kind of flounder out there? Wouldn't you rather have a trusted partner to be number two? And send them to us as an alternative? And that worked, and they do get a lot of quote unquote overflow from the hospital in home care for folks that they just cannot service, staffing shortages and everything else that's going on. So know that the first thing you want to do is evaluate the target and evaluate where you might be able to fit in. Now, access. Access is such a problem here, guys. I feel it, you feel it, I live it, you live it. It's just amazing. The access challenge that we have today is much greater than even 5 years ago. So, what do? You got to use your human connections. I can give you many, many examples. I use the sales reps a lot from the affiliation that I'm desiring to get into, because they are often in the know, and they may not know kind of above a director level, but they sure know what's going on at that home care or that senior housing. Where are some of the challenge points with discharging? So they get it and they know, and oftentimes you can be friendly with them enough to get the information that you need, and at the very least try and get a warm call up into that organization. But don't do that call, don't go in for a big strategic call until you got your ducks in a row. Also, I would share with you, use your staff. It comes to mind that I was trying for probably 3 months to get in with a specific hospital, and the VP of home care and ancillary services didn't do it, just was struggling. They would say, fill out this RFP, and I would, and it just wasn't working. And the owner that I was working with, he was very active in the state association. The VP of home care was very active in the state association. We thought that connection would work. It wasn't going very far. And then lo and behold, the the intake supervisor at the hospital was an intern or did her clinicals with one of the team members at the proprietary home care, and we were able to use that connection to get us not only the RFP through um, to be a partner, but then turn on that faucet. And it was amazing. Once we made those connections, literally patients started flowing in within 3 days. So I think sometimes it's about, getting to the right person. I've gone to conferences, I've gone to events to try and get in front of the VP of Ancillary Services. One comes to mind. I was at a conference, and the VP, who was a physician over all ancillary services at the hospital, was a speaker. And I just simply waited until he was done speaking and went up to him afterwards and said, I've been trying to work with you, and I'd like to set an appointment with you to have further discussions on how we may best position ourselves as a secondary provider for you. And he was very amicable about that. In fact, he said, oh, so and so is my right hand. Here she is. Could you please get with Melanie and find her a time to meet with me? So sometimes it just is about being creative and looking to what organizations they belong to. Thank God for LinkedIn and other places where you can identify where they might be, or if they're speaking, so that you can put yourself in front of them. It's often just that simple. You need to get in front of the right person to have these discussions. Now, of course, you have to be prepared. You can't just walk in again and say, hi, I'm Melanie, I'm here to help. You have to have done your homework so that you can identify what else is going on strategically in their mind or some of their service holes, so that you can fulfill them. But access is going to be a problem. Most reps are going to stop at the door, and if you are going after a big partnership, you are going to need to be very creative about how you connect with some of those leadership positions. So you heard me say top down and bottom up. Bottom up is the reps work in the system, the nurses, therapists, caregiver supervisors working their connections, while you or the owner or the managers are trying to get at a leadership level to have further discussions with them. All right, so who to target? Good question. Great question. So after I do my fact finding, oftentimes, I look to intake to have them help me understand what some of the challenges are, or care navigation, or care access, or patient services, whatever they're calling them these days. And understanding what some of the challenges are there, usually I can get that information from the reps. And with a good question, with good questions, you can get what you need to get out of there. Obviously, you also want to go top down, because if you can get the blessing of the leadership, then it makes it much more easy to roll out. And so sometimes they are also in this process. I mean, sometimes it's just timing. I can think of one hospital system that we went full force with this, and at the same time, they were going full force with this. They wanted to pick out 5 providers in the area to try, quite frankly. They were working on a pilot program, and we happened to be coming at them at the same time. They were open to this idea, and they were putting together kind of goals for a partnership, or goals for an loose affiliation. Of course, none of these are contractual that I'm describing. They're just kind of loose affiliations with overflows or preferred providers. And it was the right time. They were ready for it. They were open. They wanted to do pilot programming, and we wanted to do pilot programming. So look at who to target. Well, it could be, and look for titles like fun, and this is where LinkedIn helps you. Look for fun titles like, partnership development, inside that home care division at the hospital, and see if you can't find somebody who's strategically working on, maybe acquisitions or partnerships or affiliations, because oftentimes they can help guide you, because that's their job. Their job is to find appropriate partners. Obviously, if you can get to the VP or president of that division, that would be lovely, so that you can certainly have more robust discussions. Oftentimes they push you down to maybe the director level of home care, for example, which is just fine. it's often like getting the blessing of the boss and then keep going to the folks who actually handle the patients. So there's a plethora, everything from, clear at the tippy top, president, vice president, down to kind of down through the flow through director and intake, and the sales rep. So there, you want to have a multi-pronged approach. There isn't just one way that I can tell you to go in, because oftentimes, as you know, it's trying many different ways. And if we have learned nothing in this business, it's about persistence. So how to best prepare for a meeting? You heard me say that a couple times. You can't just walk in there and say, hey, I'm Melanie from Home Care. We do bathing, dressing, grooming, and meal prep. Or, hey, I'm Melanie from, Medicare Certified Home Health, and we do OT, PT, speech, and nursing. Woohoo! Everybody knows that. So what are you going to do? Look at your outcomes. People are talking about outcomes now. People want to know what your outcomes are. If you have good outcomes, let's talk about them. Maybe you don't have great outcomes today, but you're a good, solid agency. It's just that the nurses aren't documenting exactly the way that you hope they would in order to get some fabulous outcomes. Look to other areas. What do you have? Can you get there same day? Can you get there within 24 hours of the PT? Do you have a big old service area? Lead with your strengths. Figure out what you got. Oftentimes, if you can share your readmission rates for particular diagnoses, you're going to, get their attention. How much money that they can save by keeping these folks at home will get their attention. If you're in home care, you're looking at what are some of the challenges with their readmission rates, and do they ever have challenges with folks going home? How you might be able to best prepare for those types of events. High risk patients, as in high risk to return. So I think there's lots of ways that you can best prepare, but you're really going to utilize. Remember, I said you got to do your groundwork first. Every meeting's a little bit different, and you got to figure out what their problems are, or what their challenges are, or their pain points, and that's what you use in your meetings. Sure, you have your kind of stock best things about you, and keep those, but it'd probably be more impactful if you had direct suggestions to some of their pain points. So prepare, just don't go in there and wing it. This is one time you really need to have an agenda. If you can get questions answered from this VP beforehand, or this home care director, or the intake person beforehand, ask good open-ended questions to them so that they can understand, or that you can understand what some of their challenges are, then you'll be best prepared. I'm just thinking of one right now where before our meeting, I asked intake what some of their challenges were, and they said a particular area in the city was a huge challenge for them to service, because they just didn't have staff members in that area, and the agency I was working for did, and so we really kind of brought that home. That was a highlighted point, and we wouldn't have known that going in. And I don't know that we would have been as prepared if we didn't know ahead of time that that particular piece of the city was a challenge for them, so that we could highlight the number of staff members we had in that area. Piloting. I love piloting. It's a chance for you to prove that you are good, that you deliver on what you promise. So if you go in there, and you heard me talk about the one home care company that said we're going to try 5, or hospital-based home care care navigation team, who said we're going to try 5 different home healths and in-home cares to pilot and see which one we enjoy working with the best. And quite frankly, what a great idea. They got to experience it. They didn't have to. They had a scorecard. They were really well prepared. Same idea you heard me say about those guys in Texas. They piloted a bunch of CHF patients. They proved they could keep them out of the hospital longer. And so that pilot program was then the foundation for becoming the secondary provider. And, when I say secondary provider, some people go, oh, geez, that's not enough, Mel. You're just going to get 1 or 2. No, I'm telling you, I have hospital systems that are on the Medicare side, bringing out anywhere between 25 and 80 patients a month to a secondary provider. They just can't handle it all. They don't have enough therapists and nurses. On the in-home care side, It's different for every hospital, of course, but you're still looking at a huge opportunity just to be overflow. If you can find the niche in which they don't serve, certainly you can create pilot programs around them. I know a number of in-home cares who have created pilot programs for high-risk patients, taking them home, helping them stay home, and the hospital system is listening to that. So please know that pilot programs are really a chance for you to shine. I always suggest them because I, as a sales rep, can go in there and talk till I'm blue in the face about how great we are, but do they really believe me? People don't buy from brochures. People don't buy just because I say we're great. They really buy, they commit when they see it as an action. So pilot programs are a way for you to do that. And follow-up systems, follow-up and feedback systems. Wow, this is so super important. This is how I get these sales reps back in on a consistent basis. The hospital that I described that had the care, like the care access team or the care nav team behind the closed door off-site in some low-level building, it's kind of a bunker in the middle of downtown. We would never be able to get to them to quote unquote call on them, but we can get to them with follow up and feedback systems. So I have one rep who does it on a weekly basis. She goes in and she shares with the patients that she took under service, the patients that she did not and why, and then also kind of frequency and what services that they are gaining. I have another rep who does it on a quarterly basis at a very large hospital that you would know the name of if I got to say it out loud. Um, she gets to go in on a quarterly basis and sit down and talk about the number of patients. She has a list of patients that they saw, patients that they were no-go'd or didn't take under care, any challenges that they had, feedback loops to the social workers and case managers, and also the CTO is there to talk about how um, technology-wise, how those referrals came in. We have a lot of the CNO is there to talk about anything clinical. Of course, the director of social work and the director of case management. So it's a nice team. It's a high-level team, and it's a really open discussion about things we can do better, challenges we've had this quarter, goals for next quarter. It's really a lovely experience, and there's no way I would get in front of the CNO any other way, or the CTO, or the director of social worker, and the director of case management, all in one room. But we've created this environment where we're able to share and have these meetings, and it's been lovely. Now, that's a huge example and an example of a huge win. It isn't always that pretty. I understand. But you as a sales rep could do this very easily at your CTOs. For those of you who follow Michael's top 20 selling methodology, please know that you're really doing essentially that monthly recap. If you remember on step 5, when he suggests you do that monthly recap, and he utilizes it as a methodology in which to make sure that they are giving you at least one a month or one more a month. I utilize it not only to do that, but also to create this feedback structure and a valid business reason for me to be in there once a month. If I can get it once a month, I'm getting it. I know, and like I said, the lady in California that I worked with, she goes in once a week because it's been that effective for her to go in once a week and share with the hospital the patients that they've served. Same can be done with in-home care. These referrals they give to you or that that you take under care, go ahead and go back and talk to them about Mrs. Jones and where you're at. And maybe it's just simply that you did the home assessment or you're on schedule to do the home assessment. Whatever it is, whatever actionable thing it is that you have in order to follow up, go ahead and do it. And make the most of it. I mean, here we are in some amazing, amazing times. I think even though it's a little chaotic right now, I really think this is some of the best time to sell Medicare certified home health, hospice, and in-home care. I have been at more tables in the last 2 years of places that I never would have thought we would have got to maybe 5 years ago when home care was kind of an afterthought. And we just said, oh, here we go. We're going to we're just gonna check the backs on home care, or if they get in home care or not, it's really no skin off of our back. So we're just not gonna, we're not gonna worry about it. And the hospital's very transitional, or transactional, I should say, very transactional. Have patients in 2 days and then they're gone. So I would share with you that this is an opportunity for you to shine, get to those higher level discussions. I appreciate that today's webinar was a short webinar, giving you some tips, direct tips from the field that I have utilized in order to do this. In Orlando in January, it'll be much more in depth. I'll share with you some of the tools that I've used, some of the feedback tools, so that you could go home and create your own vertical integration kind of package. And I think that's where we all need to go. The fact that you're on this call today says to me that you are forward thinkers, you're very progressive, and you want to spread the message of home care and serve more clients and more patients. And that's what we're here to do. We recognize that this is a huge opportunity. Those home health, private duties, and hospices that get aligned with these large systems and get the trust of these large systems, please know you are going to be in their sites for bundling, which is brilliant. So as you know, essentially right now they're testing all of us, and those of us who are good partners and have a seat at the table, it's going to be very, very, very logical. When they go to a bundling event, when Medicare starts paying them in the bundle, guess who's going to be in that bundle with that system, home health? You are, because you're proven, you're known. So now is the time that you need to get out there and get aligned with some of these big systems, because in the future, not too distant, we're talking 2, 3, 4 years, we are going to be moving to that bundled system, that bundled payment system. And that's when they are going to really choose who they're going to work with and pay. The hospital's going to pay you. It's going to be a different environment, and that also allows them to pay for in-home care too if they desire. So you have to prove your value, and today is the day to do that. You can do this. So join me. I know January seems like such a far away, but we're on the Thanksgiving Christmas slide, and it'll be here before you know it. So please do sign up, get your 15% off. The promo code is just simply the word webinar. When you go through that, you can go to HC as in homecaresociety.com and click on save the date, or you can go to homecaresales.com down and scroll kind of down to the bottom at the upcoming events, and there'll be a link there to see the agenda and also to register. So please do register. I look forward to speaking with you there. It's going to be an amazing conference. There's a lot of fantastic speakers coming in, and very tactical and strategic for the executives. All right, guys. Well, thank you so much for spending this 40 minutes with me. I hope you got some tips out of here that you'll be able to put into practice right away. In addition, please join me in Orlando and see Mickey Mouse, of course, on your off days. But more importantly, get prepared for what's about to come. Those of us who are going to be on the front end of this are going to win. We are going to win big. We are going to be able to care for more people and impact more people's lives. Thank you so much for joining me today. I look forward to seeing you. And as always, if you have any questions, please just reach out to me at melanie@homecaresales.com. Thanks so much and have a great day. Bye-bye.